Therapy sessions by discipline. Hippotherapy includes many techniques for a therapist's treatment toolbox. It is not a standalone therapy. Patients should be evaluated and functional goals set like any other treatment setting. Assessment will be similar to those used in the clinic. They may be more functional in order to adapt to the equine environment. Assessments are not necessarily discipline dependent, but are chosen based on client needs.
Now, can I change how you hold this?
Assessments include, but are not limited to, body structure tests such as range of motion, manual muscle tests, and observational gait analysis to assess temporal distance factors. Tests of function, such as sitting and standing balance using time as a measure, are quick and reliable measures. The 5 times sit to stand, as well as the sensory profile, are easily applied within the equine environment. Activity measures include the activity scale for kids, functional gait measures such as timed up and go, timed up and down stairs, and activity tests such as timed walk tests, and the Vineland Adaptive Behavior Scale, which can be used in this environment without modification. Participation measures frequently used in this practice setting include the Canadian Occupational Performance Measure, as well as standardized questionnaires such as the Pediatric Quality of Life, general and disease-specific versions. These next videos provide examples of treatments incorporating hippotherapy for the disciplines of physical, occupational, and speech therapy. Physical therapy. Physical therapists may incorporate activities to improve range of motion of the lower extremities. Examples include stretch on the adductors to straddle the width of the horse, gravity assisting with lengthening of hamstrings, along with manual stretching of the lower extremities while on the horse. Supine position on the moving horse opens the entire chest wall, along with improving scapular retractions and lengthening pectoral muscles. If the lower extremities are allowed to straddle the back of the horse, this provides a stretch on the hip flexors. Strengthening activities include the use of weights for upper extremities with varying lever arms, tossing balls, sit-to-stand transition using stirrups, and standing in stirrups. The movement through space in and of itself provides facilitation of core musculature. This can be enhanced with stop and starts of the horse, encouraging agonist and antagonist coupling. The horse provides one of the best mediums for enhancing postural control by developing sensory motor function. Therapists can manipulate environmental cues by asking the client to close their eyes, promoting the use of vestibular and somatosensory systems. By having the client sit sideways or backward, the therapist provides atypical visual cues, allowing the patient to practice filtering sensory information for postural control. Additional developmental positions on the moving horse promotes further somatosensory mapping to promote body awareness and assist in motor planning. Getting on and off the horse, as well as transitional position changes on the moving horse, supplement motor planning activities. The equine environment offers multiple challenges and motivators not available in a traditional clinic. These include walking steep inclines that lead to a horse, or maintaining balance while providing the horse with a treat. Taking advantage of the sensory motor input of the horse, the therapist may then work on functional skills that further enhance permanent motor learning. All of these activities, either on the horse or in the environment, are structured to meet the patient's therapy goals. Occupational therapy. Occupational therapy is client-centered and depends greatly on what each client needs for functioning in his or her daily life. Occupations may include ordinary activities of dressing, eating a snack, reading the paper, driving a car, and telling a story. Occupational therapy focuses on those tasks that may be difficult to do because of a myriad of problems. With the horse and horse environment, an OT may focus on sensory processing through sequencing tasks, various tactile surfaces, visual motor integration, or listening and responding to graded directions.
You do it. Do the hoop.
Because being on the horse or in the horse environment is sensation-rich, many clients benefit from this integration of visual, motor, olfactory, auditory, and tactile senses. An OT may also work on cognitive tasks, such as planning an activity, following the steps, and cleaning up the area.
Try and pinch it.
Often fine motor activities, such as reaching for a ring or tossing a ball into a basket from the horse, can develop coordination and challenge balance, as well as focus attention on the task at hand. Grooming activities with the horse may facilitate self-care and motor development, as well as learning the body parts, colors, and numbers, which transfers directly to school-related tasks. For people with physical impairments that make everyday functional tasks difficult, mounted sessions provide a movement challenge which builds core strength, stability, and balance as a foundation for occupational performance. The OT may also focus on functional skills, which address specific upper extremity impairments, and integrate them with the rhythmic postural challenge afforded by horse movement. Manual tasks similar to those the client needs to perform at home, at work, at school, or on the playground are employed in the therapy session on the horse to facilitate practice of fundamental skills. The rhythmic movement of the horse at the walk facilitates occupational performance of many different skill sets. Occupational therapists may also engage clients in appropriate social and emotional behaviors in the equine environment by having expectations and rules to follow, facilitating team skills, and setting up situational role plays to develop proper social engagement. After a mounted session in which equine movement has challenged and enhanced the client's ability to perform functional tasks in a movement context, everyday functional tasks can be added into the session on the ground. This creates an immediate link back to the performance needs of daily life. These tasks could be removing the helmet, which requires a pinch grip on the clasp. The client could brush the saddle area, comb the mane, or brush their own hair in an effort to carry over skills learned in this environment to more functional activities of daily living. Even changing to clean clothes to go to dinner or putting on a coat will require fastening buttons or zipper, using the skills practiced while mounted. Helping the therapist to collect treatment equipment and putting everything away, and even remembering to do it all in a planned sequence, can reinforce skills that were learned while engaged in equine movement. This translates to enhanced life skills that improve performance in the client's everyday life and home environment. For some clients with ADHD, for example, planning an activity and then focusing on and executing their plan can be quite difficult, interfering with their daily lives. Tasks that are left unfinished or messes that are not cleaned up frustrate many parents and teachers. The environment in the barn provides many opportunities for planning and executing activities related to the horse and the therapy session.
Like tall Neil?
This is just like tall Neil, isn't it?
Occupational therapists will engage advanced clients in preparatory activities to plan and sequence their treatment session, or assist impaired clients to remember and execute 2 to 3 step directions while on the horse.
Trade with Sarah and shoot the green ball.
The treatment sessions on the horse or in the equine environment can be very complex treatments where clients will improve their executive function skills. Speech-language therapy session. Equine movement can be used to facilitate the neuromotor systems that support speech and language function. Prior to targeting specific speech articulation tasks or receptive expressive language use, the speech-language pathologist can use a period of measured equine movement to promote improved postural control and overall stability. This, in turn, facilitates oral motor jaw stability, respiratory support for speech sound production, and enhanced sensory motor performance throughout the articulators. Equine movement has also been shown to positively impact arousal and general information processing, such that decoding and encoding of language can be positively influenced. Standard speech and language therapy strategies are then overlaid on the movement of the horse, either dynamically or statically, to address the client's communication needs. The setting is rich in naturalistic conversational context and communication opportunities, which then provide the speech-language pathologist with both naturally occurring communicative interactions and the opportunity to create specific speech and language tasks both on the horse and off the horse. Evaluation and treatment planning are no different when hippotherapy is part of the treatment plan. The speech-language pathologist conducts a formal speech and language evaluation using standardized assessments appropriate to the client. Examples include the Arizona Articulation Test, the Preschool Language Scale, and the Comprehensive Assessment of Spoken Language, as well as functional communication probes and speech-language sampling within the therapy sessions. Treatment goals will be consistent with goals written in any other clinical application of speech-language therapy. In reality, the speech-language pathologist is simply harnessing dynamic movement to promote a positive systems-wide neuromotor influence on human communication performance. The pragmatically loaded environment inherent in hippotherapy offers added opportunities for the treating therapist to incorporate real-world speech and language tasks and training. Interdisciplinary interaction. Occupational and physical therapy and speech-language disciplines often incorporate similar activities to provide opportunities for specific emphasis on functional goals unique to the client. The functional goals of the client become an interdisciplinary focus, where teamwork and co-treatment allow a more integrated and comprehensive plan of care.